Good afternoon, Henry Wilbur. Let's begin the warm-up session. Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you like most about your profession?
What I like most about my profession as a nurse is the opportunity to make a meaningful difference in people's lives every day. Nursing allows me to provide compassionate care and support to patients during some of their most vulnerable moments. The ability to offer comfort, alleviate pain, and promote healing is incredibly rewarding. Additionally, nursing is a dynamic and ever-evolving field that challenges me to learn and grow. I appreciate the collaborative nature of healthcare, working alongside dedicated professionals to deliver the best possible care. The relationships I build with patients and their families are deeply fulfilling, and knowing that I have positively impacted someone's health and well-being is what drives my passion for nursing.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many of the things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Your preparation time is over. Please start your OET speaking roleplay.
Hello, Mihiraa. I understand you've just received some significant news. How are you feeling about everything right now?
Honestly, Henry, I'm feeling quite overwhelmed. The doctor just told me I have type 2 diabetes, and it's a lot to take in. I don't really know what this means for me or how I'm going to manage it. I'm only 34, and I never expected this.
I can only imagine how you must be feeling, Mihiraa. It's completely normal to feel overwhelmed and a bit scared when you receive a diagnosis like this, especially when it's unexpected. My purpose today is to talk you through what this diagnosis means, answer any questions you have, and give you some initial advice on how we can manage this going forward. We'll discuss your new diagnosis of type 2 diabetes and create a plan for you to manage it at home. We'll take our time, and you can ask me anything.
Honestly, Henry, I'm feeling quite overwhelmed. The doctor just told me I have type 2 diabetes, and it's a lot to take in. I don't really know what this means for me or how I'm going to manage it. I'm only 34, and I never expected this.
That's a really important question, Mihiraa. I want to reassure you that type 2 diabetes is a very common condition, and the good news is that it's highly manageable, especially when diagnosed early, like yours. It doesn't have to lead to severe complications like those your uncle might have experienced. With the right lifestyle changes and sometimes medication, many people live full, healthy lives with diabetes. You'll have a lot of support available to you, from your doctors to dietitians and other healthcare professionals. Before we delve into the specifics, what, if anything, do you already know or understand about managing diabetes? Any initial thoughts or information you've come across?
Well, I know it has something to do with sugar and diet, but I'm not really sure what changes I need to make. Do I have to stop eating everything I like? I'm quite active already, so I'm not sure what else I can do there.
Those are excellent points, Mihiraa. You're right. Diet and physical activity are key pillars of managing type 2 diabetes. We certainly don't expect you to stop eating everything you enjoy, but we'll focus on making smart choices. For dietary changes, the emphasis is on balanced meals, focusing on whole grains, lean proteins, and plenty of fruits and vegetables. Portion control is also very important, thinking about how much you eat, not just what. We'll also work on limiting sugary and highly processed foods, as these can cause significant spikes in your blood sugar. Alongside diet, regular physical activity plays a huge role. We'll aim for at least 30 minutes most days of the week. You don't have to start with intense workouts. Even starting light with brisk walking or cycling can be incredibly beneficial. Regular activity helps your body use insulin more effectively, which in turn helps manage your blood sugar, gives you more energy, and can also help with weight management, all of which contribute to better diabetes control. How do these initial thoughts about diet and exercise sound to you?
It sounds like a lot to take in, but also achievable. I'm willing to make changes. Will I need to take medication straight away, or is it just diet and exercise?
That's a great attitude, Mihiraa. Your doctor will prescribe what's necessary, and often, with a new diagnosis, oral medications are part of the initial treatment plan to help your body manage blood sugar more effectively. It's incredibly important to take these prescribed medications exactly as directed, consistently every day. They work best when taken regularly. We'll talk about the specific medication your doctor has prescribed, but generally, while most people tolerate them well, it's good to be aware of any common side effects your medication might have. We'll review those before you leave. Remember, consistency is key with medication, just like with diet and exercise, for optimal blood sugar control. Do you have any questions about starting a new medication?
Not really, as long as it helps. What about checking my blood sugar? Will I have to do that often?
Yes, blood glucose monitoring is another crucial part of managing your diabetes, especially initially. We'll teach you how to use a glucometer, which is a small device that measures your blood sugar level using a tiny drop of blood from your finger. We'll advise you on the frequency of testing, which might be several times a day at first to see how your body responds to food and activity, and then less often as your blood sugar stabilizes. It's incredibly important to document these readings, either in a logbook or on an app, as this information helps us understand patterns and adjust your care plan. We'll also discuss your target ranges for blood sugar, so you know what levels we're aiming for. How do you feel about learning to use a glucometer?
I suppose I can learn. What if my sugar levels go too high or too low? That's what worries me.
That's a very valid concern, Mihiraa, and it's essential to know what to do in those situations. Your blood sugar can sometimes go too low, a condition called hypoglycemia. Signs of low blood sugar include feeling shaky, sweaty, confused, or suddenly very hungry. If you experience these, the immediate action is to consume a quick source of sugar, like a small glass of fruit juice, a few glucose tablets, or a tablespoon of honey. Wait 15 minutes, recheck your blood sugar, and if it's still low, repeat the quick sugar. On the other hand, your blood sugar can also go too high, which is hyperglycemia. Signs of high blood sugar include increased thirst, frequent urination, and fatigue. If you experience these persistent symptoms, it's important to contact the clinic or your doctor's office for advice. We'll make sure you have the contact numbers. Do you feel clear on how to respond to those situations?
Yes, that helps a lot. It's a relief to know what to look out for. So, this isn't something I just deal with on my own, then?
Absolutely not, Mihiraa. You will have a strong ongoing support network to help you. Regular review appointments with your GP are vital, as they will monitor your progress and adjust your medications as needed. We will also likely arrange potential referrals to a dietitian who can provide more personalized meal planning advice, and potentially a diabetes educator who can offer in-depth guidance on all aspects of diabetes management. Remember, consistent management is key for your long-term health and preventing complications. We're here to support you every step of the way. Do you feel you have a good understanding of the importance of these ongoing support and follow-up plans?
Yes, I do. Thank you, Henry. You've explained everything very clearly, and I feel much more confident starting to manage this.